Hi everyone, myself Indrani Chatterjee. I'm an advocate parent of a young adult who is on the spectrum. On behalf of Team The Spectrum Autism, I'm going to host episode 72 of Talk to the Expert series. The Spectrum Autism is a parent support group committee to create awareness about ASD and the role of the community when it comes to supporting the families of children on the spectrum and other special needs. On the spectrum autism, the theme this year is empowering parents. All our projects and activities are around finding ways to empower our fellow parents. In today's Talk to the Expert series, we have with us our esteemed guest, Dr. Pankaj Kumar, who is a neonatal specialist and an experienced pediatrician, is practicing successfully over a period of 14 years, who believes in reaching out to community and promulgate the correct information about any subject. Today's topic of discussion is ASD and exploring age-specific milestones from pediatrician's perspective. Before getting into detailed discussion, let's have a glance at his extended series of achievements. Now, his degrees are past Bachelor of Medicine and Bachelor of Surgery, MBBS, 1999 to 2005. From Institute of Child Health, he passed out DCH as Pediatrics, March 2009 to 2011. He completed his DNB Certificate of Training Completion in Pediatrics Residency Program from Peerless Hospital and B.K. Roy Research Center, Kolkata, 2013 to 2015. He has also done his courses of DCH and DNB Level 3 course on blood product transfusion and Level 3 course on children safeguarding MRCPCH UK. His experiences are, as a student, he served Calcutta National Medical College, August 1999 to March 2005. As postgraduate trainee, he served Institute of Child Health, June 2010 to May 2011. In Medica Super Specialty Hospital, he managed all sorts of cases in pediatrics, in ER, OPD ward, and even NICU and PICU from July 2011 to April 2012. And then as a consultant pediatrician, he served Global Health Care System Private Limited from May 2012 to November 2012. As resident doctor, he served Peerless Hospital and B.K. Roy Research Center, Kolkata from February 13th to February 15th, February 2015, that is 2 years, 1 month. Here he also took his certificate of training completion of 2 years post DCH DNB training in pediatrics and neonatology. In Medica Super Specialty Hospital, Kolkata, he served as associate consultant from March 2015 to April 2022. And currently having core interest in neonatology, he joined Goa Medical College and Hospital in July 2022 as IAP Fellow in Neonatology and is gaining huge experience in the same. So with a huge welcome, we invite Dr. Pankaj Kumar to Talk to the Expert series. Welcome, Doctor. We are so fortunate to have you in this episode, and I'm sure that through constructive discussion, you will give us a better perspective on ASD and exploring age-specific milestones from pediatrician's point of view. Welcome, Doctor.
Good evening all, and thank you, Indrani ma'am, for such extended introduction. And I will definitely try to take all those issues, and if any questions I would love to answer about ASD. Though I am not expert in that, but being a pediatrician, it's the first halt for any parents who have any concern about their child's development or any other milestone.
So my question actually starts from there. Firstly, I would like to ask you about your experience as a pediatrician. During your service period of 14 years, have you ever come across any differently abled child or a special need child, someone who is on the spectrum?
Yeah, if you talk about special need child or child with any developmental issue, so many children I have seen. But if you talk about ASD, again, yes, not that many, but many children have come across with spectrum in the spectrum part of the ASD, because this is a very broad uh, aspect. ASD in itself is a spectrum which has very broad perspective, from very mild to very severe. So we have come across quite a good number of cases of spectrum.
Okay. So if any parents comes to you for consultation saying that their child is not displaying age appropriate growth, how do you guide them to assuage their anxious mind? How do you advise them to decide their course of action under such circumstances?
Yeah, this is a very good question. Actually, this is the first thing that happens actually. And uh, in that case, the most important thing is not, not to panic at first instance, because let us first examine and see whatever your concern is, that really your concern is really issue, like it is an issue, or it's just your thinking that there is some problem. Firstly, that thing. The second thing is, here it is very important that when you have come, what is the age of the child when you have come with this concern? Whether you had this concern earlier, but you thought that yeah, it's okay. I think we should give some time, and some delay happened. So these two factors are very important, and it depends. And our approach after that depends on these two factors. Whether first we will examine and assess whether really there is any concern with the development, and this development in which aspect, because development has got many aspects, like motor, fine motor, gross motor, then verbal, then social. All these aspects are there. After that, it depends on which milestone is affected, whether it's affected or not, and at what age you have come. That further course depends on that actually. But most important thing is not to panic at first instance. Just hold on, and just see how it goes. Not to panic actually.
So I would also like to know from you what actually this delayed milestones imply, and does always delayed milestones also imply that the child is imbibed with some intellectual disability like autism and etc. So what
Actually,
exactly do we mean by delayed milestones?
yeah, that's
Can
what I
you
told.
explain
This
that?
delayed
How
miles.
should parents understand that yes, their child is going through delayed milestones, and they should be alarmed, or they should become alert that it's high time that they should approach some pediatrician for consultation.
Yeah, that's important. Actually, delayed milestone. As I told you, milestone has many aspects. Like in which aspect your milestone is delayed, whether it is motor functioning, and motor is also not only just gross motor. There's fine motors also, like hand movements, finer movements, and gross movements. Apart from that, there are speech and language, and then social milestones. Delayed milestones means these milestones are not achieved on time.
Okay, okay. So then I would like to know that who is the correct person to help the child who has been detected with intellectual disability or is differently abled, and what is the role of a developmental pediatrician in training a child with autism? As we often come with this term, developmental pediatrician. What is the role of developmental pediatrician to help a child who has
Okay.
special need?
Yeah, actually, they may be of quite help, because what happens in such cases, like uh, as I said earlier, that the parents with concern most of the time will go to a pediatrician that I have this concern. pediatrician suspect that this may fall under spectrum ASD group. So in that case, a good pediatrician will counsel properly what is his or her concern and how it should go. Like, he's not the right person to stamp spectrum if it is very mild or moderate type of disease, because everything what a person like a doctor says is very important. Its repercussion may be very long term. So what we do, we suggest to go to a person, doctor, who has special interest in this, or special training in this behavioral aspect of children. They are developmental pediatricians who looks mainly after developmental aspects. They are training much better way, and they know what are the things to look for. What are all the things to look for? We, a pediatrician, may not know, because we are general pediatrician. We know everything, but we don't know everything in all. That's why we just uh, act like traffic police to guide them in proper direction. So developmental pediatrician has a very important role, and this awareness should come now, that because it's an era of subspeciality. Pediatrician is there, okay, he can treat your cough, cold, and minor things, and you guide you. But if something is specific thing, then there are a specific person for that. Now like cardiologist, a pediatrician can't treat cardiac illness on his own, so he will send to cardiologist. Similarly, will send parents to a developmental pediatrician who are better trained and better equipped to stamp spectrum. So their role is very important. And if nowadays ASD means autism per se, very known to term for people. They understand what autism may be. So if they have concern, they can directly go to developmental pediatrician. That is what I feel like. They can go. So their role is very important in spectrum or any behavioral issue with this age group.
I would also like to know, how is a developmental pediatrician, the role of a developmental pediatrician differs from that of a psychiatrist or a psychologist, or is it the same?
No, not same at all. Then will come. Then that's why I told you. If you come to a pediatrician, he will send you to developmental pediatrician, and then also it suggests you to go to some psychologist, a clinical child psychologist or psychiatrist. But he can be reserved about that thing. He will first send you to a developmental pediatrician, and if he thinks that really there are significant behavioral issue in spectrum aspect, then he will suggest you. He will ask you to go to a psychologist for proper behavioral assessment, because they have tools to assess those IQ, and there are many tools with them. So their role is also very important. So in nutshell, it is MD, multidisciplinary actually. It will involve your pediatrician who will guide you, will involve this developmental pediatrician, it will involve clinical child psychology especially, and psychiatrist also, because in some cases you may need medication which psychologist can't prescribe. So in that case, you may need to go to, because this spectrum may be associated with hyperactivity, which may hamper day-to-day life. In that case, some medicines may be required, which should be prescribed by psychiatrist actually.
Okay, so in that case, someone has to go to the psychiatrist and find out if the child has to be under medication.
Yeah, if it is required, only then. But psychologist very important, because psychologist and developmental pediatrician, they will assess the child mainly in their aspect. And one thing I would say that these things happen only after the assessment of hearing of the child, whether hearing is okay or not. After that, you have to go ahead with all this.
So the child needs to go for a better test as well to find out.
Yeah, because this is directly related. If you can't hear, you can't communicate, and you can't verbalize.
Okay, because you see that early intervention is very important. If the child is
Yes,
actually in need of some special treatment, of some special help to, gradually get into the normal flow of the life. So in that case, that early intervention really helps a lot.
very
Because it's
important.
often
Yeah,
seen that in a child, if it gets delayed and the parents approach the doctor after quite some time, then it is very difficult to make the child go with the commands of the therapists or other people. So, do you think that the parents should really be prompt in reaching out to a pediatrician or to a psychologist? What is your opinion about that?
yeah. We always suggest parents. We are very nowadays scenario has changed quite a bit. Now the approach for a treatment for a child, we always suggest them to uh, keep a low threshold in any condition. If you have any doubt, then you please come to us. Go to your pediatrician or anybody who you think is able to pick your child's thing. This is very important, but sometimes it doesn't happen because of many factors, many environmental factors. Family, there may be some problem there in environment or in their working hours, those things, and maybe they don't have much time to look into all this. These are the factors, these are the real factors, but still we say that if you have any concern, uh, keep a low threshold, because a baby or a child can't express things. They won't say that I have this problem, I can't do this. We can say, but they can't say. So if you think that something is not right, it's not looking right, it is not like it was previous, even that should prompt you to go to an expert pediatrician.
So it's the earlier it is better.
Always, because of this awareness that they know, and they go to doctor, and doctors are also even aware about this autism, because earlier we used to see less cases, but it's not because autism was lesser in number at that time. It is because our awareness about autism and those clinical signs and symptoms, we were not very much into that. So we our it was very back into our mind, so it would come very late. But nowadays scenario has changed, awareness has increased. Our approach also towards any verbal issue, we think about autism now.
Right. So now these days that early detection is possible. Like earlier, we used to see that a child who is like 2.5 years or 3 years, it used to take that long for to detect in a child that the child has something different, and the child
Yeah,
is not showing the normal symptoms like any other neurotypicals. So now that can be detected much earlier. That's what you're trying to say, that within
yes,
16
yes,
to
yes.
18 months it can be diagnosed. That's a significant aspect, that the acceptance comes very slow in parents also. Even if they find something is going wrong, they don't like to accept it, like okay, my child may be different. So that is another point. Like, so what are the other symptoms that should also be a concern for the parents in an infant? Like when the child is not able to communicate, or is not in, still not in that state, like between 15 months or 12 months, when the child is of that age. So other than sleepless nights, what can be the other symptoms which should also concern the parents, and they should like consult the pediatric?
Okay, this is a very good question, and again I will say that first thing, anything if you think is concern of concern, anything that you think is of concern, like he can't do this, he was doing this, but now he is not able to do this. That is called regression. That may also happen, and they will not play with other. They will play on their own, okay. So social, this solitary play.
Okay, now I would like to move on to the next question. While doing collaborative project with Talking Fingers team, a book co-authored by some parents were asked a question. What message would they give to the parents who have been told rudely by the therapist or child psychologist that their child is nonverbal? So, and also my point is whether it is a therapist or a psychiatrist who are breaking such stringent news about a child to his or her parents should be a little sensitive about these matters and deal with it compassionately. So, what would be your advice to the therapist or psychiatrist or psychologist that how should they handle such sensitive issues so that the parents concerned aren't aghast, not panicked? So, what would be your advice? How should they break out the news, or how should they deal with the parents so that they do not panic and they do not feel low about it? Like
Okay,
it's
okay.
not any, it's not a crime that their child is going through this state or they are going through this state. So, how they should like help
Um,
out the parents or break the news to them?
okay. First, I will tell this thing that now these things are changing actually. Uh, Means breaking news like this bluntly and just saying a thing. Now these things are changing in our scenario also. This is in Western world they are very particular about all these things. How to address these things, how to break this type of news, and how to be sympathetic and empathic and sensible about all these things. But now scenario is also changing in our country also, and I don't think that we just tell bluntly that your child is non-verbally, he's going to be he's having autism, he's going to be break this now again. But yeah, sometimes this may happen. And about psychologists and psychiatrists may sometimes say break this diagnosis, but I don't think now any one person uh, uh, say all these things about especially any behavioral issue, and especially in this age group children. So, and second thing, my advice will be like anyone's advice. Like if uh, I have uh, a child like this, I would not like to hear things like this. So you should communicate same way as you want to hear yourself.
Right.
So basically your approach should be like you have to be very empathic, you have to be very sensible and accountable for your words. What you are saying is having a good, as I said earlier, it's going to have lifelong repercussion, what you are saying. So these things, these news should be broken very sensibly. This will be advice not only from my side, for everyone who is in this profession, that these news should be broken with very sensible approach. And now about who should break the news. Actually, it's very difficult thing. Like if parents come to me, I will ask them to go to developmental pediatrician. We will ask to go to psychologist. Then after overall assessment, the clinical this developmental pediatrician, they will assess, they will say everything, they will write to their prescription, and they will send back to me. Parents may come to me. Then I can also tell that, oh yeah, there's in your spectrum aspects. So now we are planning like this. So then the role will be totally of developmental pediatrician, how this will go, how special educator will come, and then come into scenario, and then how we will plan further uh, you know means education and further management of this particular case, because all cases are different. All as this is spectrum, so this may be very mild, this may be very severe. So for uh, first you have to categorize it in which category the child falls in, and then uh, plan accordingly. So this is very difficult. Who will break the news? But if these have assessed the child, like pediatrician, developmental pediatrician, clinical psychologist. Then we can say that, yeah, this is, anyone can break the news, but breaking the news in a sensible and empathic way is very important, because then everything is, the whole world around you is going to be changed.
Right. Like it should not like sound that the world has come to an end, what I feel.
Yeah,
And,
yeah.
and
And one
and
more thing,
from the
one more thing,
side of
one,
the psychiatrist or the psychologist, it should not be just a flat statement. I think with that, some solution should accompany that. That you don't
yes.
need to worry that if you go through such and such process, we can win over it, or
Yeah,
we
that's what
can
I
help
was
this
telling.
to minimize.
Yeah, one more thing I wanted to add, that if you have been told bluntly about this, then just take a deep breath, take a pause, take a break, and then switch. Then go to the person, uh, get some other opinion who you think may be better than this person. Just like you have to then ignore. You can't help it out. So you just take a pause, take a deep breath, and move ahead. Go to another person.
Yes, but step by step, if we go, then the parents also can like prepare themselves mentally a bit.
Yeah.
So for all the outcomings ahead. And one more thing I would also like to say, like, it is as it is in a long process from pediatric to the developmental pediatrician, then to the psychiatrist or psychologist. Can there be health institutions where we can have all these different sections under one roof? Then it
Yeah.
becomes really easier for the parents to go, because in going to different places it's really very it's quite strenuous for the parents, and there are certain parents who are not even educated enough to understand all terms and everything. So if it is under one roof, then I think it will be much more easier for them to attend
Yeah.
the
Yeah.
doctors and to find out exactly what has happened to the child. So is that
Yeah. All.
possible, or is it
Yes. Yes.
happening?
All. Uh, there are two aspect about this. One is that where such institutions are there, that is the problem. Then you will go to a pediatrician, then he will suggest you, he will find out one developmental pediatrician for you, or a person who is not developmental pediatrician, but pediatrician who has good interest and have some training in behavioral aspect, because in smaller place you won't get a developmental pediatrician.
Right.
Okay, in a metropolitan, in a tier 2 city, you may get, but in small places, you can't even get developmental pediatrician. Forget about this institute which is dealing with these things. So in that case, that is why when I said that a pediatrician, then developmental pediatrician, then psychologist, doesn't mean that first you come to me, then go to them, then you will go to who is somewhere else. No, it's like you came to me in my department. There are developmental pediatrician. I have sent you to that area. Then he will ask you to go to other area where clinical child psychologist. So this may be under one roof also. So there are some places where under one roof all these things are, even the training program and other assessments are also there under one roof. There are few centers, but the centers are very few in our country, and smaller places it's very difficult. So those who are living in those areas, it's very difficult for them. That's why it's a challenging. Now you have to move around, you have to go somewhere for the training, for the education, and for implementation of some interventions. You have to come out of your, you may not be able to, because it's not possible always to uh, go and stay there and do all those things.
So if it is under one roof, it is really helpful for the parents who
Yeah.
is already going through a very tough situation. So that way, I think it really helps the society. Uh,
Yes, there should be
now,
more, many more.
yeah, under one health institution and all departments, if it is there, then the parents can reach out easily and more promptly, of course. That is another thing. Maybe in a day or two, in a couple of days or something, like they will be able to cover much more. Then they have to visit in separate places, in different
Yeah.
directions, I mean to say, if they have to go.
Yeah.
Okay, my
One
next
more thing,
question.
one more important thing is now everything is after COVID, that we can communicate through these meetings like video calling, and so this may be of quite help for those who are in faraway places. This
Right.
may be helpful.
You mean to say online consultation?
Yeah, online consult, even training program can be inducted. Some centers are doing this. It's what you call strategic treatment for spectrum disorder. They try to create environment at their own home. They will tell you how you have to set up at your home, and at that particular time you do like whatever they say, you do like this. So parents can at their own home can try to manage accordingly.
Okay. Now, my last question would be to you that what message you would like to give to the community as a whole about building an inclusive environment and their approach towards differently abled members so that we together can live as one whole community.
Society is very important so that everybody understands what the spectrum is, how they should be dealt with, and they should encourage their family members and their children to interact with them, to try to understand them, and to include them also. But it's not very simple. As I said, I'm saying it looks very simple, but it's not that simple, because that age group, to make them understand, is also very difficult.
Very difficult.
So yeah, so it's you have to give tremendous effort, and you have to make plan, you have to think how you should go about this. So many things need to be done for that. Actually, this is another aspect actually.
No, what I feel is like if the adult comes and interferes in this area, that it can make the matters easier for the younger ones. They can help the younger one to understand that the child is not actually different, but is also a part, very much part of our community, and that the child should be included in all the affairs, in all activities.
Yeah, that is the message actually you already said, and I think the message is to include them into the community and make part of them as a part of your own community, your own Nike. And we don't have to think in the smaller aspect like what will be next. We should think about the future, because they are going to grow old. They need a support system later when their parents are not there. Then who will take care of them? So we have to make a society, which we have to make a community, we have to make an environment where these aspects should also be considered, and the support system for them at that level should also come.
So thank you, Dr. Sumal. So that was an incredible and insightful session we had with you, discussing different dimensions of autism and learning many known and unknown factors. So I would like to sincerely thank you for being with us, giving your precious time to us, and give us so much valuable information about autism. I hope people out there will also be benefited when they go through this.
I would like to help you. Actually, thank you actually for inviting me for this session, because I am really overwhelmed with this. I wanted to be part of something, something meaningful in life. So it's thank you all for inviting me.
So we need more people to support our mission, to support this, what we are going through. So we are really thankful that you have been that support to us today. And maybe in future also we would be looking forward having you in many of our sessions. And I would also like to thank the audience who have joined us today in this session to hear us and to support this. And before ending, I would also like to say that April is the Autism Awareness Month. We invite everyone to take the pledge of inclusion. So that we are actually trying to reach 1 million. So please help us to reach that goal and to spread awareness as much as possible. So with that, we come to an end. Thank you, doctors. Thank you, everyone.
Thank you. Thank you. Good night.
Good night.